Hello, and welcome to Spiritual Shadow Boxing. And we have been away for a little bit, but we're back for year 2022, which is going to turn out to be, I think, a wonderful year of expansion and changing our perception. And with that note, we have two amazing doctors here on our podcast, Dr. Ken Davis and Lisa Davis, and they are here to share their years of experience with healing modalities of harmonics and how they have combined what they've learned into their own unique way of healing the body, the mind, and the spirit. So welcome, guys. Welcome you back there from TechWin.
Thank you for having us.
Yeah, we were really excited to have the opportunity to come back again, and I think I remember the last interview. I think we could have gone on for hours after that one. So it's great to have the opportunity to come back.
Absolutely, great.
It goes so fast, So
it does go very fast, and thank you again to come back, and we can start this discussion and really kind of dig in a little deeper about what you do, because it's really spectacular. I've been a patient of Dr. D for over a year now, so I've experienced firsthand what he can do for your body, for your mind, for your spirit, and it's just all together in one amazing session. And it's like he often says, it's peeling back the layers. Every time you go, it's different. I've never had a treatment that was the same. It's always different, and things always come up. So, yes.
that's a good point. That's a great point.
Yes.
The layers, right? Yeah. Cal, I'm wondering, do you have us on gallery view?
I do.
Okay, cool. Just checking.
I do.
Yeah, I wanted to name too, having worked with Dr. D more recently, and the richness of just the possibilities of health, what health is in a different lens than maybe Western medicine has provided me with. So curious to dive into some of that as well, what health is to you all, the levels of health.
Yeah. So I guess that's a good place to start, right? I'll let Lisa start on that.
Well, look, as we had said the last time, we've been working together now in our 45th year. And before any of this health movement started, none of it was around. There weren't even health food stores. There was just kind of a raw desire for something different. And there were really a minority of people that were trying to seek, they were eating oats and things like that. And we were so incredibly lucky to have both had the same kind of mindset that there was more that needed to take place in healing, right? And Ken always felt that way in school and the classes that he took years after. And we went in head first. We went in head first when there was nothing. There wasn't even, people didn't even do acupuncture at that time, by the way.
It was frowned upon.
Yeah. So we had experiences, and we decided to study and follow the possibilities of what other people were doing around the world, and what are the possibilities that we could tap into to make a difference. And the thing about Ken was that he was always looking to make a difference, always learning a course in some weekend that would help a person. It wasn't necessarily a mass of people. It would be this particular person needed help. And whether it was nutrition, but we landed in energetic and vibrational healing through an incredible teacher and group a long time ago. And that helped us realize, oh, wait a second, there's so much we don't know.
Right.
So much we don't know. And we risked it all to know at that point, as much as we've come, you're only as good as you are that day. And always I think both of us have spent our entire lives trying to stretch that envelope, to learn more, to be part of something that maybe no one's touched before, you know? And
I love
that-
that. I love how you said you risked it all to learn more. I love that. You know, that really
yeah,
kind of
that was a priority of our life, I have to say, you know? And the stories are unbelievable. Sometimes when you think about them, go back in time, like another life, actually, you think, if we only opened up as a culture, as a humanity, to the greater possibilities that we could tap into, oh my God, you know, like, and what's preventing us from doing that? What's preventing us from going further? You know, so we're stuck in our minds and in our pain and in our loss. And also we have to have this thing to see something. And one thing I learned a long time ago, and both Ken and I learned, is a lot of it is beyond the seeing of your eyes.
perception, right? Like it's back to
Right.
that perception.
Like when you get to that level, there's something, but you have to have faith, because faith believes in something that you cannot see, you cannot know about, but you believe in anyway.
Yes.
So, you know, it's going to a place that is not logical. It's not substantiated yet, perhaps, but maybe in signs of people that you've helped, right? But there's something in an awareness of learning the art of feeling. And then the patients have that as well. Something takes place that, I don't know what you did, doc. Like, I don't know what you did, doc,
Yeah.
but I feel better.
I feel
What did you do?
better.
Well, I feel better. You know, I've been feeling this way, and this is what drove him to learn more and stretched me to develop the gift that I have, by one person at a time, really.
That's beautiful. I love that story, and I love your commitment to it, and how you guys was. My favorite word lately is steadfast. I love that word, steadfast, and I really, you know, people that just something that's beyond them moves them, drives them to want to know more, to want to understand more. And that is such a unique gift that you guys have shared with so many patients throughout your 45 years together. You've been working together. And I think that it's just, you know, we reap the benefits of your dedication.
And as she said, we never feel that we know enough now anyway.
Yeah, I mean, and that's the exciting part, to get to an age you didn't know how your life was going to turn out, and still have this hunger.
Right.
Have the hunger every day, you know, of realizing, you know, it was funny. There's a question I ask my clients. I'm a life coach at this point. That's what I do, because I realized that they were in the physical aspect of working on somebody that people didn't necessarily have the tools to do on the other 167 hours of their life in a week to change things, right? And so that was the part, to learn to change, to go in and to grow yourself. And then your health has, you know, it takes that lift of the person participating. They don't have to have understanding, but they do have to participate in some way. And that turns the car and makes it go back uphill, no matter how steep that car has gone down the hill.
So maybe I can ask you a question that's not on the list, and Fareska, if you have the list handy, I'm just trying to look on my phone for the list of questions. But my question has just popped in my hand, listening to your story. And, you know, I can throw this out to either of you, but maybe Dr. D, how do you feel that your work has changed now than it has like 45 years ago or 30 years ago, or even 2 years ago?
Well, the first answer I would give is that, remember, a lot of the work in the harmonics that we ventured forth into utilize the devices or instruments that Dr. Rees had developed, called harmonics. So the harmonics were, actually, I could show you what one looks like, if that's okay.
Yes, we love that.
Great.
Excuse me for 2 seconds. See, as I mentioned, is that a harmonic primarily, what Doc researched was, again, as I mentioned, a lot of the principle of piezoelectricity, which was researched and developed by Madame and Pierre Curie back in the 1800s. And the principle of piezoelectricity, and what they found is that by applying mechanical stress and pressure, certain gemstones in the rough, when applied pressure to and tap, elicited a specific electrical discharge. And they researched and experimented with this and were able to take that and light up a neon lamp. So by tap and brush technique. So Doc was a prolific researcher and developer of many, many inventions, one of them being a phenomenal invention that were used to help the Army in World War II, where he developed, based upon the principle of harmonics and resonance and piezoelectricity, devices, these harmonics or harmonics, that would take a waveform and cut the wave off so that it could distinguish the difference between the enemy's radar system and the American planes. And they hid this equipment, you know where? In Dutch windmills. They camouflaged it.
Oh, really?
So
Wow.
Doc always remembered, so when he was a real electronics genius early as a boy. And, but as he ventured forth into healing and went to chiropractic school, he never ever forgot this principle that he had studied and learned and was into as a boy. So there's other, mystical components about his story. I'm not going to spend so much time on that. That led to the creation of many, 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 not only inventions, but healing disciplines, and one of them being harmonics, which he never forgot the work or the inventions and the creativity that the Curies did. The principle, so what's so different is that the utilization of the physical instrument has evolved to the point where we don't need the physical instrument anymore, but the same effect of the frequency or the vibration in which we're utilizing, our hands become the rheostat or the harmonic, but not this, and but what's different that separates the harmonics from everything else, I haven't seen anything else, is the fact that it's not just laying on of hands, because laying on of hands does not have an element of background and understanding, first of all, of what energy you're calling in, what you're utilizing, where it comes from, and right, is it positive or negative? Because Lisa and I teach that there is duality in the universe. There is positive and there is negative. And negative feels good. And this is what people don't understand.
Interesting. Can you say that again? Can you elaborate on that particular thing? That negative feels good. So
Well,
I'm going to come
can I
back.
say something, Kenny, about that?
If I can just finish, let me just finish the thought, and I would absolutely love for you to say something. Also, I was going to also say that, as you know, there are many so-called healers. See, also, one of the things that I learned is that no one does the healing. So I don't even use the word healer, and I don't really like it. I'm just a conduit. I'm a conduit to be able to learn a system that creates a level of ability to use these energies and be the vehicle to allow these energies to be amplified. And that's different about the harmonics than anything else. The way in which the energy becomes amplified from where it originates through a process that takes it into our hands. The other problem is that so-called healers utilize their own energy. And they utilize their own tissue crystals in their body, and so their battery runs low very fast. And that's why you have a so-called healer that works on two people all day. They're exhausted. They work on one day, then come back to the following Monday because they can't handle anybody else. So in our day, not that, but only because of research, I was seeing 40 to 50 people a day doing what I do, having as much energy in the morning than I did at the end of the night, because the energy doesn't come from us, it comes through us. And the energies in which we work with do not originate in our realm of reality, but need a vehicle to be able to be amplified in the three-dimensional realm and be clinically viable in not being in the room with somebody for an hour and a half, keeping your hands on them to make a change. So the biggest thing is that the elevation and the evolvement of the work to the point where, number one, we could really understand how we're accessing the energy, how we can bring it into our hands, and how those frequencies almost like, not almost, they do, adopt to the brainwave pattern of the doctor utilizing the energy. So it becomes part of them. It is them.
Mm-hmm. Mm-hmm.
And also the understanding that the energy is omnipresent.
I love that. Thank you so much. I have so many questions, but I want Lisa to kind of respond on what she wanted to do. And then I have a couple questions about everything you said, because my head is going. And I love the idea of like that you're the conduit and the channel. And I get such a strong visual when you're explaining that. But Lisa, please say what you wanted to.
Well, it's just in the light of it being, there's duality in the world.
Mhm.
And, you know, otherwise the world would be a different place if there wasn't, right?
Yeah, it is
So-
dual. Yes, yes.
Yes, there is duality, and being sensitive doesn't mean that you're pure, you know, or that you cannot be tapped or affected. So what happens to a person in prayer or in healing or in what you do in coaching is that you have to align yourself with that light every day. And because because as you grow, so does your opponent. And this is the illusion in healing, that it's always good. I feel it, I'm feeling you, and I got you. And you really have to, you're only as good as you are that day. And things appear in life through our desire and things like that. We don't have a choice about what necessarily appears,
Mhm.
but at that moment, there's a choice, and knowing the difference. That's the art of real healing, because otherwise you're just playing with fire.
Mhm. I love that.
And nobody really wants to know that part. They want it to be all nice, but honestly, it
All
is
unicorns and rainbows, but no, it's not all unicorns and
it's
rainbows.
not. No.
Well, you know, I love the idea. I just want to like go back to what Dr. Z said about like a channel and a conduit. My question is, so it ends up through your hands. And I love, Lisa, that you said that, you know, you have like me, I meditate every day. I connect. I feel like I'm a channel with my writing and my meditation. And I understand how like you have to be present and open and a willing channel. You have to be, you know, and you have to kind of understand and learn to discern between where the energy is coming. So my question, I know when I feel it in the back of my neck, in the top of my head. Have you learned to feel it coming through the body completely and then it ends up in the hands? Or is there a pathway that it finds itself? Or have you been doing it so long, it's just kind of
No.
second nature? Do you understand? Yeah.
Oh, absolutely. I'll let him say that.
What you're saying, but I'm going to answer the question.
Mhm.
First of all, in the process of the involvement of the work, when Lisa and I were involved in the initial stages of the system of harmonics, and being part of this international organization, the International Systemic Health Organization, that, you know, the work evolved over the years and evolved and evolved and evolved, where new energies revealed themselves and so on and so forth. But the element of was that what Lisa was talking about is what we call protocol, doing your private ceremony and component every day, to be able to, also the fact that we live on a free will plane is important to understand.
Right.
Because by living in the free will plane, we have to ask for God to be present. We have to ask for these energies to be present. We also have to understand, as Lisa was saying, that there is a hierarchy that exists in the unseen world, and that certain energies and what we call the protocol are higher than other ones. And you can't just call them in and whatever. So, but the understanding and learning about this was something that we were involved with for decades, not going to a seminar over the weekend and all of a sudden calling yourself a master in this or a master in that. That is, we think that's, to us, that's hypocritical. And that's just, you can't, because it's like the 10,000 hour rule. You have to 10,000 hours to master anything. So, but as the work evolved and more of these energies revealed themselves in the process of the work and the creation of harmonics and other things that Doc and we were doing, new harmonics were made, but other ways of accessing the process. So as the organization grew and grew and grew, up until the point things began to change in the way in which, especially in light of the fact when Doc passed away, there was information that was gathered, Lisa playing a vital role in that, of how the organization was to move forward. And the thing that people also don't understand is there are energies in the work that are called and the Bible teaches this. In the Bible, there are what are called the all-seeing eyes of God. And the all-seeing eyes of God are the energies, the two cherubim that sit on the right and left side of God. And they see everything. But the thing that we learned is that the all-seeing eyes are all the crystals that not only exist in your body, but in the world, in the universe. Now, the point I'm trying to make is that there are, amongst all the crystals in our body, are specific tissue crystals that sit themselves in specific areas. And in our system, Natural Force Healing, that Lisa developed, with me helping her, but I give her all the credit, are specific tissue crystals that when an individual makes a commitment to be a practitioner of that system, one of those crystals in the back of their head is actually turned on, not by us, but by those energies involved in the work. And there's other ones. So that, say again?
It's like a tissue crystal of enlightenment. Something's transcended.
There is another power center that's evolved over the decades of how the energy is accessed from a particular area in the world that we were involved and responsible for, where these, what we call the positive universal force energies, which are billions beyond number of energies, positive, who are what we call the positive universal force energies, to give you a definition, are the positive energies under God that ever were, are, and ever will be. And certain of those energies, which have been around for millennia, are part of the natural force healing system and also are involved in the harmonics work. So when an individual, in the way you're asking of accessing it, is that through a particular way, these energies can be accessed that have a platform to be amplified from one place through the crystal in the back of the head and into the hands instantaneously when the individual has learned the work and the energy that they're working with. So it's a very, very specific process in the way in which the energy is accessed. Also, getting back, if you don't mind me telling a little bit story. See, Lisa and I, in the early days of being with work and working with Lisa, we had mystical experiences that people couldn't even imagine. The other thing that I want to mention is that, and Lisa mentioned before, is that in the healing world of all the stuff that's gone on, and as Lisa said, there wasn't anything back then. There was no, now, and the problem is in the healing world, it's all homogenized, as I said. But, so there were very unique experiences that both her and I had early on as we dove into the work and in our relationship with Doc Rees. And I'm going to speak, in Lisa's gifts and abilities unfolding, and I am writing our second book about these experiences too. in our travels was that every night Lisa would get, there were sessions that would take place, and she would get a headache after our last patient. And our first office was very unique back then. It really was. It was below ground with window wells, so we didn't know if it was summer, spring, fall, or winter outside, whether it was raining, sun, whatever. And there was many, many learning experiences that we had in that office. So Lisa would actually get a headache and go lie down on that table, and she would be out for 2 hours. And in that time, many of these energies that we work with used her as a vehicle to talk. And I was the scribe. And I wrote things that you couldn't even, that told us about our life, who we were, what we were going to be doing, techniques, procedures, things that have taken place in the world, and so forth. And I began to learn, also I could not take my hand off of her heart. I had to maintain contact with her because these energies are powerful in our little pea brain bodies. So I always had to maintain. Also, they wouldn't even let me tape record it. In those days, there was a voice-activated recorder. I would record it. The next day, there was nothing on.
Oh, yeah. Yeah, that happens.
But the point I'm making in the story, it's a fascinating story, was that in that time frame of being and listening to these, and it's like we were developing a relation, even though Lisa was not so much conscious. These energies, which are what we call the energy of the protocol that we've worked with, I began to know them and understand. And when I felt them come into the room, but the difference was these types of energy, also there's lower levels of negative energy that like to talk. And when they find a vessel that has a gift like Lisa does, they're going to try and come through. Mm-hmm. But they'll say a word. They'll talk in a certain voice. They'll make something that you know is, you know what? This energy is not positive. And I learned that for days and years and years and years. So that's why we know that I know the difference, because it would, excuse the expression, that these energies kicked my ass. And I learned and I became sensitive. Also, I used to ask Lisa all the time, Lisa, how can I do what you do? How can I see? We have in that office, I tell the story, she used to see these colors in the side window downstairs in the cellar there where we were, I call it. I said, what colors? I don't see any colors. She goes, over there in the corner. I said, I want to see those colors. She said, says, well, do this. Maybe one day you will. And one day I did, like 10 years later. You know what I'm saying?
Amazing.
So we have to, and so Lisa would teach me also things that I had to do to become, because I wanted to be sensitive, but understanding too that we all have gifts, and my gifts are not the gifts that she has.
Exactly.
You know, but together that's why when Lisa left the office in Ridgewood to have Austin, our son, I said, you can't leave the office. You can't leave.
You're like, it's time.
The baby. Do not leave that office, because with Lisa, I didn't have to think in her gifts and abilities. My job is to bring the energy. But it forced me also, thanks to her, to become sensitive. Plus the natural force healing system, which again, as far as I'm concerned, there's nothing like it, in addition to the harmonics, because a lot of it was based upon not only our travels, but it comes from a foundation of physiology, anatomy, the harmonics, Doc's work, from a professional level, not just a hodgepodge of stuff that's just put together to kind of do your thing.
Yeah. This is the place I wanted to dive into a little, because I'm imagining for some of our audience, right, who have seen Western doctors who have gone in, done the lab work, haven't felt well, and the doctor said, oh, everything's fine, all your lab work checks out. who have left discouraged, defeated, confused. What makes this system so different? And I've experienced it, but I also want to ask you too. What makes it
Just
so
here for a minute, Lisa, you
holistic?
can have the rest of the hour. The thing that
we,
makes
got, we got you for a minute. There you go.
Yeah, all right.
me get excited when I talk about it, no different than I was when I was 30 years old.
It's beautiful. Yeah. And I'm just curious, like the word that comes up for me is holistic. It's not deep enough. It's not the right word, but it's
Well, let
way
me just
better.
say, it's not. And
Think-
the idea that, we've been put in a little bottle of limitations. And not that people shouldn't go for tests, they should go for all their tests, go to doctors, get checked, all of that. But then they don't want to take responsibility. The body never lies, and it always tells you before you're sick or before something happens.
Interesting.
But we don't pay attention. We don't pay attention that I shouldn't have drunk that. I shouldn't have said that. We're not looking in. So we just keep moving forward, moving, and we're not taking any responsibility that may have, make it that I'm supposed to wake up, that I need to wake up and take responsibility. It would be like buying this great car and just shoving it in the garage and letting dust grow on it. You have to take care of it, otherwise it will rust. And that responsibility to look further. Now, one of the things that we learned that we believe in is that the body's 1% of who we are. 1%, it's the glove that goes over the hand. That's all, right? It's not the hand. And then the mind emotion is 9%. But the spirit, that's the driving force, the life force. And without it, you're just a person lying on the floor with a white line around you. There's nothing going on.
Yeah.
But if we don't address that, with the spiritual issues, our needs to grow, right? Our need to get beyond the things of our own personal karma, of our life, of our history, of what we've learned, what's been imprinted upon us, then we're always apt to be suffering from it, right?
Mm-hmm.
And it will either come into the form of the mind or into the body. It takes all the slings and arrows. So when he asks the body, what's wrong with you? We're asking if it's in the body, the mind, or the spirit. So you could have 10 people with the same symptom, and maybe only one of them would have it come really from the physical area, even though they have a physical pain.
Mm.
But even if it's coming from the physical area, it's the physical that's manifesting what it's taken on from disturbance in the mental, the spiritual side of the triangle. So just to follow up, it's exactly right. See, what's different is that as far as we're concerned, illness never happens physically first. Never.
Mm.
Never. And that what separates what we do from everybody else and what we learned in that model, as you were asking for us, is that Doc taught us the triune of well-being.
Mm.
And the model or the foundation of everything that I do and we do stems from an evaluation of the triune model of health. As Lisa said, 1% is that, see, the 1% side of the triangle, the physical, is the ability to move from point A to point B, the musculoskeletal force of the body, to move your arms and whatever, and the blood, the bone, really not so different than an animal. It's only 1%. So, but as she said, the doc, so this triune model of body, mind, spirit, 90% of humanity's ills and breakdown come, as Lisa said, from the spiritual side. The inability to forgive, to be pissed at your father for 20 years and can't, to forgive, to feel love in your heart, to receive it, to recognize also that we are spirit first, which is something that's missing, or what we call, that's the lack of recognition that I'm an immortal spiritual being is a disturbance that alters the spiritual side of a triangle.
Yeah.
So it doesn't matter what symptom or component or condition, it all traces back to the triune. It comes from the triune of well-being. Also, we teach, as you know, you guys know as patients, that this triune model, there is a blueprint or an archetype that exists in all of us. Perfect.
Yeah.
But we are adaptation machines since the caveman.
Mm-hmm.
And when we have a stress response, The question is, can our nervous systems, first of all, adapt to the stress, recover from it, and move on? And if it can't, that's when a layer of the onion gets constructed. And the layer of that onion also records itself in also how it alters and impacts itself in parts of your body and your energy field. See, the harmonics primarily, and even a lot of in natural force healing, is the basis that there is, and I'm not talking about the aura, which is another, see, people also talk about things that there's a lot of people that are book smart and can get an A on the test, but they do not apply what they read into the elements of their life on a daily basis. And they don't have a full comprehension of what's really going on. They have a little bit of knowledge, and then that they think that's it. So there is, whether you call it, we in the work call it the Tamir. The Tamir is the blueprint, Doc named this, that comes when you're born and leaves when you die. And this Tamir is from 2 inches from within the body to 2 inches above, around your hands and feet. It fits like a glove. So kind of synonymous is the etheric double. Now, what's so fascinating about the work and what Doc found is that this melodious, beautiful, etheric envelope that surrounds not only human beings but all of life can become disrupted due to varying factors that causes a discordant vibrational pattern in the cells and in the body that leads to what humanity calls illness or the name of a condition, and that's what the harmonics were based upon. So when Doc made a harmonic, that harmonic had specific minerals and stones that were programmed with a frequency to alter that discordant vibration and bring it back into normal. There were 5 major changes that a harmonic did in a human being's body. 5. So it's a discordant it's like a piano being out of tune. So if the cells of your liver are not vibrating or out of tune, we're going to see manifestation, or in the brain, or in the emotions, as Lisa said, or in the spiritual component, and so forth and so on. So the element of the understanding of the triune is what separates us. And also, which I haven't seen anything like it, giving her the credit, is to have a testing system that in minutes and seconds, you see, can identify, regardless of the symptom that the person has, what angle of that triangle it's coming from.
Yeah.
So when you stand in front of somebody, again, Lisa said, and you come into the office, your being, so to speak, is going to reveal in the moment what I am. Am I in the body, the mind, or the spiritual angle? So the levels of energy in the work has been created to address that particular primary angle of disturbance and peel the onion and bring that back into balance. That's what the work is all about.
So incredible. So incredible. And I think as a patient, one thing that's been continuing to grow in me as an awareness is, again, Western medicine, yeah, take the test, do the things, but there's a diagnosis and then there's sort of a rigid sticking to that diagnosis. Week after week, month after month, right? It's almost like a pathology thing. This is what you've gotten. We're not checking for anything else.
No, he's always checking. He's always checking. Always checking in that moment. But the thing is, the body's revealing you need to either continue to work on this thing. That's what we're talking about, the layers of that particular thing. Yeah. So a person could say, I have allergies, and you come in and has nothing to do with what we're working on because the body says this is not the major right now. You understand? Right? So it's like, we need to get back to, do you have a trauma at some point 6 months ago that affected your immune system? And that's how accurately the system's able to read the body.
Yeah. And that's what lights up for me is every time I come in, it's other layers. It's I'm not being put in a container with having diabetes, for example. I'm being checked in on week after week as my body unfolds, as spirit unfolds.
Yes. Right. Yeah. That's a beautiful thing.
Yeah. And the question I have for you both, because I've heard you say this, Dr. D, when I think of going to a doctor's office, they ask me things that I consciously know. Intake forms, do you do this? Do you have that? Do you got that? But you seem, and Lisa, maybe this is from what you've gleaned and channeled, you're talking to the subconscious, it feels like, the parts that would be a blind spot for me personally. Is that accurate?
Well, remember, in all of it, you have to realize there's no separation. So you're reading cards about an oracle. It could be anything. It could be tea leaves, okay? It could be the arm mentor. You're asking the universe, consciousness that has all the answers now, ever were, and ever going to be. Mm-hmm. And so it's an artful form to inquire, removing the patient's idea that they think, or the doctor thinking they know anything, right? You're reading a map of the body in real time. It's not a judgment. It's just a reading, right? So, and once you understand the idea of no separation, right? None between you and a tree or a bird or another person or someone on the other side of the country. If someone calls me on the phone and asks me a question, well, how do you know that, right? It's because there's no separation when you resonate like that.
Non-locality in quantum physics.
Right.
Yeah. So there is
and
no
that's
separation.
what the work does. When he queries something in your body, it's not from the wealth of knowledge that he has, because he does. It's from something, a wealth of knowledge that exists, period. So it doesn't have to know, well, do I need even a medication or something, right? It might be needed.
So I actually, Lisa, want to ask you a question. I want to kind of go back a little bit and just talk a little bit about, like, Dr. D talked about how you first started, and you would have the headache and you would go and you would get the download. My question to you as a medical intuitive is, can you explain maybe at the beginning when it first started and now how it feels in your body and how you see it or feel it in other people? How's that process work for you?
Well, it's changed over time. And, Ken was witness to it. I was very young. I didn't know. I didn't ask for this, by the way. It was not something that we were looking for or trying to experiment. Just happened. And initially, it happened as discomfort in the people that I just happened to be writing for him in the office, and horrible pain or nausea or headache and he goes, and I'd say, write down, check it, and he goes, how do you know that? Like, what's going on here? And so because he was such an incredible diagnostician in what he already did, that he'd check it and he goes, and he'd work on it and it would disappear on the person and then it would disappear on me. Wow. And we realized it was so accurate. And I was really an innocent or ignorant. I didn't know the difference. I wasn't trying to do anything. You understand? So then I thought, I have to develop this. He realized it was something real. I realized it was something happening. Dr. Rees knew, I've been waiting for you all my life, and pushed me hard. And I had an experience over the years that very few people have. I've traveled around the world with a group of doctors, all studying to try to find out a way to do something great. So I grew exponentially because of it. Those tests, I'd ask him, boom, I get an answer. You know what I mean? It was something that pushed me. And so that's what it was like. It went from pain to, hearing it in my mind. And then Ken taught me anatomy and physiology and all that. And I started to understand how the body went and where organs were. And then over time, it was seeing it in my mind's eye, right? And then now it's faster than it has nothing to do with me. It's faster than my ability to think. But the difference that I'm aware of as I've gotten older, in my 65th year, is that it's a feeling. So I use this description in knowing. The mind has a lot of chatter and can try to figure something out. That's not what we do. We go to the ultimate and limitless possibilities of what it could be. And there's a feeling there. And if a person learns to remove what they think they know, you have a feeling. And if you've ever been fishing, this is the metaphor I use, and you put bait on the hook And you cast it out there. You don't see the fish and lines dotting across the water, and you're waiting and waiting, and all of a sudden you hear this noise, bzzz, and the line goes out and the rod goes down, and you go, what do you say? I got it.
Yeah.
I feel it. You don't necessarily see the fish, but you feel this thing.
A tug.
And that's what I have. That's what knowing is.
Mm.
It's like, okay, so someone asked me a question, boom, that's it, or not. So it's no different than him using the arm mentor with you, and it's a yes or no. You can't, there's no denying it. And it was very hard for me to explain for years. Like, what is it? I couldn't even understand it. I couldn't even describe it, but I know. It's a feeling of like that.
Mhm. I love that. That's great.
Yeah, I also feel the passion in what you're both sharing. This, what you said early on was like this raw desire, and then this learning and this hunger, thirst for learning. I still feel that aliveness in you both as you continue this journey for decades. It's incredible.
See, for me at this point, and Lisa knows this too. I mean, see, what does it for me, because of the element of it, is I like when, I mean, there's been miraculous healing things that have taken place over the years. A lot of people, and there's only one couple, I think, that still come to me that were there like at the beginning. There's nobody else, not really. A few, but the point I'm making is that, see, what does it a lot for me is, again, as I mentioned, like incredible things from healing that happened with patients that were there, that weren't there. Plus, a lot of in those days, we would verify a lot of miraculous things with it. We'd send the patient back to the doctor, and they would check them and said, like, I'll never forget. There was a great story. There was a woman, a young woman, in her 30s, and I'll never forget, she had this, it turned out that she had, we found that, you have an ovarian cyst on the right side. And we worked, and she says, I don't have ovarian, I just went, right. I says, well, the ovarian cyst is on the inner side of the ovary, it's on the back side, and that's why they can't find it. Go tell the doctor, I said, go check it on the inside or whatever, and he'll find it. And she did. There it was.
There you go. That's good. Okay. Oh, I'm sorry. Didn't mean to interrupt.
Is that what does it for me and the work is that, I mean, I love the physical component change in people, but I like when people wake up, as Lisa said, when they have an aha moment, or when they realize, you know what, because most patients in general, I think anyone will find this, forget very, very quickly what their physical issue was that brought them into the office in the first place, at least in our practice.
Yeah.
Why? Because it's not our primary, it's not that it's not our focus, but it's not our total focus. So that's why I had a thing, I don't know if I did it with you guys, but every year I would ask the patients that was with me, at least for care for the whole year, what would you say is the major, and no one mentioned any physical changes.
Mm.
They didn't remember what they came in with. It was always about a shift with their mental or their spiritual well-being.
Right.
Like 99.9% of it, because that's where it comes from. Also, I just want to say too, with the work, and Lisa meant, when the physical side, when you test somebody, and the physical now reveals itself as the priority angle of the triangle, it's like, and you've worked with the patient for a while, that's a great thing, because the physical, the 1% is saying, oh, all that I've taken on from the mind and the spiritual layers and whatever, now you can take the monkey off of my back. All that
I think that's what I meant. Good.
So we look at this is great that the physical is coming up today, because even though I understand that you may be feeling more physical stuff in your body, it's going to leave fast. It says, oh, I can breathe.
Mm.
Release it off of. That's why I love the work so much, because it's so revealing, which still blows my mind to this day. It doesn't, the element of how it was given, how it reveals itself, where the person is at, based upon the level of energy and the work that's coming to the surface. Oh, you're feeling like in level 12.2 of the work, Lisa knows, which is the person that gets through the dark night of the soul.
Mm.
And they're growing, but they don't feel it, or they don't know where God is anymore. And am I on the path? I'm confused, every level matches out to what's going on in the process of the life of that person. Uncanny. It still blows my mind all these years later. I have to say, it's.
So I do have a question regarding that point, but even going a little bit deeper and some of the stuff that I know you work with me and I'm sure other patients, but can we talk about how your health is impacted by intergenerational illness or ancestral wounds, like, and how that comes up and how you see that? Lisa?
That's it. Yeah. Look, what I've come to understand and still growing to understand is that, and Ken taught me this, prior to coming into where we are here, that we exist, right?
Mm.
And to use sort of an analogy that, we're a light. We come into a womb of a mother. As soon as we get in there, a little lampshade goes over that light with whatever it is that she is, whatever emotion she has. No judgment about it. Then you're born into the world. You are a very specific spirit. This is my belief, So if you were born into a family from Africa, you would still have the same tenacity, curiosity that who you are. But as soon as you're born into the world, there's the events of the language and the people and all that is imbued upon that baby and their karma. So karma is really just the memory of the decisions that people have made before you.
Mm.
If we weren't to judge them, and the people that were before them that came over on the Mayflower decide to get on a boat to make them be here, right, or whatever. So we're a culmination of events and memories that are downloaded and that are part of who we are. The goal is to remove the lampshades.
Like that.
But some people have so many lampshades on them that no light emits. I call that the terrorist. Because inside them, they're the light, but they don't know that they're the light anymore. And then they make the decisions based on the lampshade and all those things rather than the light, right?
I love that.
But it's true. I mean, it's when you really think about our path, where we came from, your parents, where they come from, how'd you get here, right? Someone made a decision. So the only way that we can change that is to look inside and to be present enough so that the decisions I make right now in this moment that reveal itself in my life today are going to rewrite where I'm going. That's it.
Wow. I'm just thinking about every time I move through this world being like, am I responding from the lampshades, right? Where am I operating from on the inside?
That's right. Yeah, I love that. And also when you spoke about karma, what about the actual, how do you guys feel about the DNA passed down?
And you can add to this, Kenny, but my feeling is those decisions, those pains, those sorrows, those losses, those illnesses are the language that is marked in our DNA.
Well, there were a lot of.
We all have serious negative, we could call it, or disease DNA, and positive. What is it that makes it ignite?
Yeah, expression of the gene, epigenetics.
Exactly, is something that is in the now that we can help, right?
And you guys were before, epigenetics is the now of science and biology.
Yeah, right, of course.
You guys were doing epigenetic work 25, 30 years ago. But you were not calling it but you were talking about gene expression.
No, so the story changes DNA.
Yes, the story changes DNA. I'm going to write that down. I like that.
Yeah, it does.
now that we're doing, even in the office when you come in, are dealing with some of this new work and piezoelectricity that we're doing with the sternum and the, I'm
Yeah.
talking
Well, we did, yes.
are stimulating reflexes that one of the things that Lisa, over the last several weeks that we're working on, Lisa came up with, is that, this ancestral DNA that we have can be asleep.
Yeah.
It's not, it needs to be woken up so that the expression, our ancestors that survived winters and famine and
Right, can be ignited, our true power.
that
Exactly.
crossed in the covered wagons from Lisa and I would always talk about, I just want to say, everyone knows, I'm the Civil War, and I've been studying, he was a Confederate general called Morgan's Raid. He picked 1,200 men to travel 1,400 miles on horses over 5 days or something. And we always talk about, people can't even walk down the block. How do these people go on a horse and ride for 5 days and ride 1,400 miles across the country, like Lewis and Clark expedition, all these things, and make it? It's really mind-blowing when you think, because there's the DNA back then, that we have that DNA, but it's asleep.
I agree.
And trying to stimulate it and wake it up, because we believe that that's going to enhance our immunity, our resistance, and all these things that are so prevalent now in what's going on with the pandemic.
And our full possibility.
Exactly.
You see, and our full possibility.
Yeah.
So another thing over the years, Ken told me, we have the probability and the possibility, right? We have this enormous oak tree on our property. I think I mentioned that to you before. It's enormous. Each branch is a tree. So that's out of an acorn, that's a full possibility of that. It drops millions of acorns, that tree, every year. And they get eaten by something, a bear or turkey or deer or a squirrel, or get mowed with somebody mowing the field, or is a drought. So the probability it is not nurtured enough to reach its full possibility. So that's why we do what we do. We tap into the potential of the full possibility. That's why I coach, and that's why he works on that body, to help remove those lampshades, to make it possible to elevate to something greater.
Oh, well said.
Wow.
Well
So
said.
incredibly hopeful over here, just hearing what is possible in the work that you both do. And Lisa, I want to offer up a little time too, just curiosity around your life coaching and how that came to be alongside being a medical intuitive, a mystic, helping, collaborating with Doc. Like, how have you chosen that path as where
Can I do a preamble to that answer? And then just a second. See, when Lisa and I worked together in that office, she was mind-blowing. Like, she would she would tell a person all about what they needed to promote them in what she's talking about here. So a few times I said, Lisa, we got like 30 people waiting outside. We can't. So I said, why don't you start coaching these people and do your thing that way? And so that's all I have. And that's one of the, so I supported her. Go do that. And she did.
It took me years to, because I didn't feel good enough to do that, honestly. But I have been now for many years. And I realized that, we have, again, 168 hours in a week, and we go to massage and we do a little meditation here. But really, we have Dr. D take care of us. But in that 168 hours, we sleep, we go to work, we go shopping, we have difficult lives, we have loss, all this. How many hours are we actually spending to change this thing, to take the lampshades off? Very little. Really, honestly. So the thing is that I thought, I saw thousands of patients with him. They need to wake up. They need to show up to do something to make a transformation. They want him to make the transformation. And he did. But it doesn't last unless you participate to make it greater, to reach the full part, which we see the full possibility. At any given point, a living being has the full possibility at 70 or 65 to reach the best that they can be based on who they are, what's happened to them right now. And if we can tap into that, That's what I wanted to do, for them to have the awareness, to take the reins and do something to learn to observe. You don't do that, ain't nobody going to change. They're not going to change, right? We know people don't change. They live and die, little blips here, events happen, pandemics happen, World Trade Center happen, and we change for a minute. Loss happens to everybody. And then we go back to the imprinted things that are in there, unless we're that morning. So my question to my clients has always been a question that Ken taught me, if there were no rules, can't fail, what would your life look like? I realized it's too big. That with the pandemic, I said, what would your best day look like? With your mate, with your kids, at your job, walking outside. Like, this is it. I got only this. And if you start to live like that, you start to see and experience and want to get better. It's right.
And there's this place too I'm holding of for our audience, especially if they have curiosity here, and I imagine they will, around what if you've had something that's chronic, right? What if someone's had, I don't know, back pain for 30 years or whatever? It's the same process. Like, it's the disturbances, it's the vibration, it's just.
The person could be dying. It's where we are right now with what we have, with what it is that I am. And right now, it's not based on what that other person has or hasn't had. So all of us have loss, maybe loss of health or finances or love or a loved one or of hope, right? Or of youth, whatever it is. This is part of the condition of being human. So it's like, okay, this is what I have. This is what's happened to me. What do I do with that? How can I still tap into my best possibility with a disease, with an injury that has left you a certain way? How do I do that?
And I can speak on that because I have had an experience and witnessed myself with a chronic. I like to say I've witnessed myself with a chronic disease. I like that. I like that language better than saying that I have, because I don't want to claim that. But the thing that is, I have witnessed my body dealing with a lung condition for 20 plus years, So I think somebody that had, and that's why I came to see Dr. D, and I'm in such a better place now than I was, I don't know how long, a year ago now. But the thing is, it's like you said, it's like the narrative of what we want to define ourselves as living with a chronic condition, because, my story might be like, I can always may have this in some part as part of the story of who I am now, but that doesn't mean it has to stop me to have hope or have that expansion or take that lampshade off.
Or to tap into the oak tree in you.
Yes.
Like, what do I need to do to nurture even with what's going on here?
Yes. And,
so that I can get there. Always knowing that no matter what's happened to you, there's still a fuller possibility. There's a map in you. We know what the worst is. It's 6 feet under.
Yeah.
Right? So we don't ever think about what's the best, maybe in the physical body, maybe if I become a beacon, maybe if I do this, but not as a whole thing, and an expression of something that we can't even imagine.
Yeah. Wow, this was amazing, inspirational. I have a lot of notes. And I especially love that lampshade metaphor, which I will be continuing using that because I think it's a beautiful visual. I think people can, you can just kind of, I just see it, when you say it, like, it's all about like, our skin is our container, but the lampshade thing with the light, it's so beautiful and so simple.
Because if you look at people, and there's a lot of darkness right now, and there has been historically, and you think, how does that happen to a person, that they become so dark, that they make decisions like that? How? And they're the light. The light never went away. The light is there. So the thing is that they're lampshades, wounded, hurts, things that's the terrorist. No light emits. They don't know they're the light, and they don't express light.
Yeah.
But the light exists in there. And so that the whole point of healing is to start to reveal the light in your full potential in your physical body, your mental body, and to realize that you're a spiritual being.
Excellent.
Dr. D, is there anything you want to add to that as we gently start closing?
No, I think that's a great place to close. Says it all.
Awesome.
It does.
Says it
Thank
all.
you both so much for this.
Thanks for having us.
Just
Well, I just want to say one thing.
Mhm.
There's nobody like him.
Mhm. Yes, we know
And your
that.
physical body, go.
Yes, we will be, and you know, we will, when we put this on YouTube, we'd love to get your websites, your emails, so people can get in contact to both of you. Lisa for coaching, Dr. D for the healing modality that you provide in Montclair. And, you know, it did go out live, so we don't know how many viewers were there, but we're going to put it on YouTube, and I'm going to share it through all my social media platforms in the next few days.
Awesome. Thank you. It's been an honor.
Thank you both so much for just a new paradigm of care and
Yes.
health.
I keep thinking of the new earth, and you guys have started creating that new earth 45 years ago. The rest of the world's starting to catch up. So
Thanks. All right.
I'm going to stop
All
the
right.
recording.
Thank you so much. Thank you.